healthcare is more than just a profession. It is a calling. And at Cloud Clinic, we believe that the future of healthcare is about answering that call in new and innovative ways. Our platform is designed to empower healthcare providers like you with the tools you need to deliver exceptional care to your patients. With Cloud Clinic, you can have more visibility, track inventory more effectively, and improve your revenue. Cloud Clinic provides a convenient access to healthcare, breaking down the barriers that limit access to care, reaching patients wherever they are and whenever they need you. With Cloud Clinic, you can reach more patients, grow your practice, and focus on what you do best, caring for your patients. But Cloud Clinic is not just about technology. It is about people. It is about fostering collaboration and innovation that drives better outcomes and changes lives for the better. With Cloud Clinic, you can collaborate with other healthcare providers, access real-time data, and provide personalized care that truly makes a difference. At Cloud Clinic, we believe that healthcare is a partnership, and we are committed to being your partner every step of the way. Together, we can transform the future of healthcare and create a world where everyone has access to quality care. So, let us join and revolutionize healthcare with Cloud Clinic, because when we work together, anything is possible.
All right, let's get started. Lola, I think you want to get started, unmute your mic and get started.
Hello, good morning, everyone. Good afternoon, everyone. Welcome to the third listed medical doctor onboarding webinar organized by Cloud Clinic. This webinar is titled Adapting to Changing Demands in the Healthcare Industry. My name is Ololade Olale, and I am thrilled to be your host for this event. As we all know, the healthcare industry is constantly evolving and the demands placed on it are constantly changing. In order to stay competitive and provide the best care possible, healthcare professionals must be able to adapt quickly and effectively to this demand. So this webinar has been organized for those that have started their onboarding process to be a Cloud Clinic listed medical doctors, or as we call it, a Cloud Clinic LMD. And for those that are looking forward to become one as well. So if you're on the fence about becoming a listed medical doctor on the Cloud Clinic app, I can assure you that you will be convinced to do so at the end of this webinar. So very quickly, so we can begin, kindly drop your name and where you are joining us from in the chat box so we can get started. So for instance, my name is Ololade and I am joining in from Lagos. So kindly drop your name and where you are joining in from. Very quickly. So I'm just going to be starting with everyone. My name is Ololade and I'm joining from Lagos. So very quickly, you can drop it there. Name and where you are joining in from. Thank you very much. All right. Welcome, Emmanuel from Enugu. Thank you very much, Emmanuel, for joining us. I have Kala Ekwari joining us from Damaturu in Yobe State. Thank you very much for joining us today. So everyone can just drop their name and where they are joining us from, and then we can get started. So while you're introducing yourself, I would like to introduce the panelists for today. I'm going to be starting with our CEO, Mr. Ifeanyi Anike. Mr. Ifeanyi is the CEO of CloudClinic Limited. He has over 14 years of experience working across different sectors in the technology industry. He has worked with several IT and financial service industries, companies, and helped them build innovative products. His work experience spans across international IT and software companies, such as Microsoft, where he worked as a cloud solution architect covering the Middle East and Africa, in charge of a select next-gen high potential account in the region. Thank you very much, Mr. Ifeanyi, for joining us today. Our second panelist is Flourish Unamdi. Flourish is our product manager, and he has over 5 years experience as a business developer and product manager in the financial services industry. He's certified in product management and digital payments by Lafati Group, and he holds a Bachelor of Science degree in economics from Landmark University. And of course, our third panelist, which is Dr. Amy Ojako. Dr. Amy has over 6 years experience in medical practice and 4 years as a health management consultant. Dr. Amy is certified in clinical management of HIV from the University of Washington. She's certified in leadership and management in health from the University of Washington. And she holds an MBBS, which is a Bachelor of Medicine, Bachelor of Surgery degree from University of Nigeria, Nsukka. Thank you very much, Dr. Amy, for joining us today. And of course, my humble self, I am Ololade Olale. I am the Clerical Associate for CloudClinic Limited. And like I said earlier, I will be your host for today. All right, I can see Dr. Sharifa joining from Lagos. Thank you very much, Dr. Sharifa, for joining us. I can see Samuel joining us from Enugu. I can see Anebe joining us from Enugu as well. Dr. Kosi from Enugu, thank you very much. There's Chris from Abuja, and then also Dr. Ife from Enugu. So we will be starting. So thank you once again for joining us. Please note that we'll try to attend to all of your questions during the webinar. So if you have any question during this, during the period of this webinar, so you don't forget, just drop it in the question and answer box. Someone will definitely attend to it. And then at the end of the webinar, we'll be able to pick some select ones, read them out, and then our CEO and clinical director will be able to answer those questions as well. For those of you just joining us, welcome to CloudClinic third listed medical doctors onboarding webinar. The webinar is designed to help you understand CloudClinic better, understand how you will get paid, which is of course very important, understand our house rules for doctors, amongst other things. So as a medical doctor that is interested in learning more about this dynamic industry, this webinar is for you. We hope that you will find this session informative, engaging, and valuable. So sit back, relax, and get ready to learn and earn. Without further ado, I'll be handing over to my CEO, Mr. Ifeanyi Anike. Just before I do that, I'm going to be going through the outline of the webinar. So we're going to be learning about CloudClinic. During the process of this webinar, we'll discuss the features of the CloudClinic app. We'll be discussing the benefits to the LMDs. We'll be giving you a progress report of how far we've come with the app. And we'll be discussing the house rules. We'll be discussing the sign-up process. And of course, there will be the frequently asked questions. And then you from the audience can also ask your questions. So like I said earlier, you can drop your questions in the question and answer box. And then there will be few people that will be able to raise their hand, and then we'll give them permission to speak at the end of the webinar as well. So welcome Collins from Enugu and Kachi from Imo. Thank you very much for joining us. So I'll be handing over to Mr. Ifeanyi. Mr. Ifeanyi, over to you.
Thank you very much, Lola. Good afternoon, everyone. My name is Ifeanyi from Lagos. I think that's our modus operandi here, your name and where you're coming from. Let's keep that coming. So I'm happy for us to get started today. This is our very third onboarding webinar online event for medical doctors. And we've really, over time, the past two ones, and even the ones we've done with our partners, got a lot of information and feedback, and we're constantly improving the process. And today we have some very interesting announcements for you, which we believe will be interesting as well. But I want to start first of all, for those that don't know this yet, talk about what is CloudClinic, right? So CloudClinic is a service, is a platform we've created in Lights and Height that is geared towards making it possible for doctors to be able to consult with their patient from anywhere in Nigeria. But beyond that, we're also partnering with different medical labs, pharmacies, and reference hospitals to make sure that that process is a complete process. So what do I mean by that? When you're consulting with a doctor, with a patient, and you're trying to find out what is wrong with that patient and trying to get his health better, we're working with med labs and pharmacies that are close to those patients to be able to complete the entire process. In the course of this webinar, we're going to be able to help you understand how this works in detail, right? So we've built this very, very complicated process, this very simplified process that is making the entire process a lot easy for your patients. And the idea is that you should be able to focus on really working towards getting your patients to receive the actual care that they need, rather than be embedded into the entire complicated process of doing this a traditional way. So no longer do you need to be worrying about having to commute to your patient's location. Without technology or telemedicine solution, you can do this from the comfort of your home. And we're doing a lot of these things and we're going to see those details down the line. But let me talk about the vision that really drove this company and made us who we are today. So first of all, we started with saying that we're providing access to quality healthcare for everyone anywhere in Nigeria. Now, this is a very bold vision, and we understand that it's not something that comes easy. To say that our vision is to provide quality healthcare to everyone anywhere in Nigeria is quite a bold statement, but we do believe this is possible. We believe it is possible, and we're working towards that. And with the advent of modern technology, like and some of the infrastructure development that's happening in the industry, in internet services provision, we believe this is even more possible than it was when we started out this journey. And we're really working with our technology to make this work. Now, what is the mission that we have that is helping us achieve this? The mission talks about how we plan to achieve this. And what we believe is that we're engineering the future of healthcare with focus on access and convenience through technology. So our My CloudClinic app, our different solutions that we've built, the partner app, the web portals that we've built around this solution is all working together in synergy, figuring out how to really make this process easy for you. And then we're constantly improving the process. We've had conversations with different stakeholders. Some of you on this call are part of those conversations. We've had conversations with different stakeholders as well in the Ministry of Health, both in Enugu and even at the national level. Conversations are going on to really understand what the pains are and how this would really help make this process a lot better. All right. So let's look at the other aspects of this to really understand why are we talking to you today and what exactly does it mean to be a listed medical doctor. Now, this is a term, the term LMD, that we coined within CloudClinic that talks about a listed medical doctor. We believe that over time, every doctor in Nigeria would want to be a listed medical doctor. And why do we say so? Because of the different things we've built around listed medical doctors on CloudClinic. What it means to be a listed medical doctor is that you will be a member of the CloudClinic directory, right? Being a member of the CloudClinic directory of doctors means that you are approved to practice medicine in CloudClinic. And there's a process to go to become one. There are different things that needs to happen. There are processes you need to follow. We need to verify your license, for instance, and then we need to make sure you understand our house rules, because we want the environment to be sane, because the doctors on our platform are actually our ambassadors. They're the ones interacting with our patients, and we need to make sure that environment is safe for them. A listed medical doctor also has credibility and professionalism as well. So the person in question is someone that we can rely on to be professional in his dealings on the platform. Now, it also increases your visibility. So if you're a listed medical doctor on CloudClinic, it means that automatically you have access to a lot more patients than you would ordinarily. And it's also a bragging right to, about the invisibility that you will get as well. Then there's also the access to technology and resources. Just being a member of listed medical doctors on CloudClinic and being on that directory, it gives you access to a lot of technology resources, some of which we're going to go into in details, within this webinar, and some are going to come down the line. There's a lot of work we're doing with AI. There's a lot of work we're doing with different technologies in the background to really make the experience a lot easier and seamless for you. Just keep an eye on that. Some of these things are not out yet, but they are cooking in the pot, and you'll get to hear about them very, very soon. Now, there's also the ability to be able to publish on content on CloudClinic MKC. So the MKC is the CloudClinic Medical Knowledge Center, which is a unique initiative we built into CloudClinic to help your patients to handle what we call preventive medicine. So no longer do they need to get sick before they can get help from you. If you publish some content within the MKC, your patients will get to learn about how they can avoid even being sick in the first place. And if they have something that's worrying them that you've talked about, that also brings them to you. We've seen, based on what the simulations were run, that MKC will be a major changer in the industry based on how it's structured and how it will work. And it's a win-win as well. For doctors that publish on MKC, they automatically get a lot of visibility. They will then become authorities in their field. It will be very similar to publishing, published articles and peer-reviewed articles online. That's the level we're looking at this being. And there isn't conversations on how this can become, give you credit points as well down the line. Not yet, but we're looking at how that would be to really encourage that contribution in that industry. There's also a lot of networking opportunities for LMDs. LMDs will be able to connect each other. There will be events from time to time where we'll bring you together to really begin to socialize. We have consultants as already registered today with us in different specializations, and the ability to be able to really interconnect and work with these people is a major advantage of being a member of this community. And of course, the least of it all is increased earnings. If you are a listed medical doctor, you no longer need to rely on your salary in the hospital where you're working in. By being an LMD, you'd have access to be able to consult at your own pricing with patients across Nigeria. The distance is no longer a barrier to you. The only thing is about your availability to be able to take those consultations, which you can do at your own time. We'll build this to be very flexible to make it possible for you to be able to speak to your patient at your own convenient time. So this definitely is a game changer in how this works. Now, the next slide on your screen talks about our partners, and truly our partners are our strength. So one of the things we've done is we're partnering with different medical labs and pharmacies, and the list you saw in front of you is just a small number. I think we have close to 80 partners today that have signed, put pen on paper with us even before our launch, and that at least close to 800 or to 1,000 more partners are reviewing our agreement and are in different stages of signing. So we're serious about this. We're being taken seriously. We're not joking with this. And you can see that with the number and the attention we're receiving in the industry as well. At the same time, we understand that we need partners to be able to make this work. There are a lot of conversations, like I've said already, that we've gotten, but we still need more. Because for this to work, what we're preaching is convenient access to healthcare. And that would mean that we need to have a foothold close to every single patient in Nigeria. The idea is that they have to be a patient, they have to be a CloudClinic partner at a walking distance to every patient. And for that, we need to do more. So what we're saying here is we need you to refer the different medical labs, pharmacies, and hospitals that you're comfortable working with as a doctor. What this would do for us is that your patients will be able to consult with those partners, or rather, who consult with you, and you can send them to those partners, a med lab close to them, a pharmacy close to them, to be able to complete the consultation process in CloudClinic. That will really help. So please use the link in the previous slide, which we're going to send to you as well in the email. Someone can actually, somebody can share that with us on the chat, so that you can start, doing that process as soon as we're done with this presentation. All right. So let's talk about our services. What are the services that we're providing in CloudClinic? First of all, there's virtual medical consultation. That's a given. What we have done with this is that we've taken it a notch higher. Not only are we allowing you to have a virtual consultation with the patient, we're also helping you do that process a lot better. So we understand that internet connectivity can be an issue. And so we're building within our telepresence technology, we're building in bandwidth management technologies within it to make it easy. So that even with slightly lower bandwidth, your consultation should still be able to go on seamlessly. And in cases where it can't happen that way, there's a way for us to be able to switch to calls. Some of these features are still being developed. I'm not finalized yet, but we're really looked at the industry. We've seen the problems there, and we're figuring out how to make this better so that you can really have a very efficient virtual consultation with your patients. Now, most doctors will not be happy to do a consultation without, having the vital signs of their patients. And so what we've done is that we're partnered with medical device manufacturers to come up with devices that are very user-friendly, devices that can work very well with any kind of patient. You don't need to have a degree in or be trained to use these devices. So we're selling these devices alongside our solution. So the idea is that our doctors should recommend these devices to their patients, so make it easy for them to be able to take their vitals from wherever they are during this consultation. Now, it's not required that this must be done. The patients can actually still, get a device outside, but we're making this possible with devices that we're sure we've tested them within our office. We're confirmed that the quality of those devices are great, and they will give you what you need. So doctors, our LMDs are not required, but they are recommended to actually recommend these devices to their patients. We've made sure that this can integrate very well with our current flow and process. We also have access to healthcare. One of the key things we're doing with our GPS technology, we're making it easy for your patients to find the pharmacy and lab close to them. So when the way the process works is that when a doctor finishes doing a virtual consultation with a patient, and then he wants them to go do some investigation, right? He will recommend those investigations, and our app will guide the patient to the closest medical laboratory or diagnostic center close to him. He goes there, he will do the test, and then the result is uploaded back into CloudClinic. He will come back in to meet with the doctor and review those results. And then some prescriptions are done for the patient, and then we'll guide the patient again using our GPS technology to the closest pharmacy where he can go there and then be able to pick up his drug. For patients that also want home sample collection and home drug delivery, we offer those services as well, so that they don't even need to leave the comfort of their homes at all or their offices. So these services are available, and we're using our GPS technology to be able to guide and direct this seamlessly with ease. Now, we also have our medical knowledge center. I talked about this. One of the key advantage of our MKC is that our doctors can publish in this platform. And we believe based on our simulation, and Dr. Amy is going to talk about some of those simulations that we've done. Those simulations have shown us that the MKC is going to be very, very useful for preventive medicine. And this is one key advantage that we have here. It also helps our doctors. For people that are publishing in MKC, it would help them with their ranking on the platform as well. So you begin to see that you're getting much more patient because people are being directed. The MKC is going to be indexed by Google and any other search engine, and it will be easy for people to find you based on the content you've created. And then the interesting thing is that once they see you, if somebody has some form of headache and they searches for headache and sees your article on headache and sees your availability, it's easy for the person to click on your list and then immediately book an appointment with you. So that's very powerful, driving, traffic to you through the content that you've created, bringing the right patients to you based on your specialization. Okay, so a little bit about our solutions here as well. Our solution is based on cloud infrastructure, so it's reliable. It's the same technology that is used across the world by very reliable services. The banks use this. Even U.S. defense industry use this as well to make sure that they have the highest level of security, the highest level of compliance, and then the highest reliability as well. We've talked about the smart devices as well. We've partnered with medical device manufacturers to make sure you get the best of these. There's also accessibility. I talked about how we're directing people to the right facilities. We're also partnering with only licensed facilities as well. So what this is doing is that we are eliminating the issue of quackery, and then the problem that might come up with having wrong investigation results and then fake drugs. So we're making sure we're liaising with the regulatory bodies to make sure we're partnering only with the licensed facilities that are obeying the right standards as well. And of course, like I said, There's a lot of specialists already on the platform. We're partnering with more. If you're one of them, please, the process about how you're going to sign up is also there as well. So I think those are the key things. I'm going to be here as well. I'll pause for now. I will hand over back to Lola for the next step in this online event. I would say welcome. We're excited about this. We're looking forward to onboarding you on the platform. Thank you.
All right, thank you very much, Mr. Ifeanyi. So I'm going to be handing over to our product manager, Flourish Unamdi. He will be discussing the amazing features of the My CloudClinic mobile app. Stay tuned. Flourish, over to you.
All right. Thank you so much, Lola. And thank you for doing justice to the introduction, the MD and CEO of CloudClinic, Mr. Ifeanyi. I would stand on all existing protocols. Firstly, I want to say special thanks to our guests for making out the time to attend our webinar. So quickly, I'll be speaking on the features of my CloudClinic app. All right. I understand that there might be some questions that have to do with the services that we're providing and our solutions, and you might be wondering, okay, so what exactly are the features of CloudClinic app? So I'll touch a bit on some of the key features on the CloudClinic app and also what you can do with them. So the CloudClinic contains exciting features which ensures that the patient's needs are met. What we're trying to do and what we've been able to achieve is to give a complete consultation experience from the doctor right to the pharmacist or the medical labs in this case, for a patient to get a world-class health experience through their mobile device. Part of our features in the CloudClinic app is native languages. All right. We understand that today there are people who we are servicing the whole of Nigeria, and there are people who might have different languages that they feel comfortable speaking with. So one of the options that we've done in the app is such that as you're a listed medical doctor, you can indicate the languages that you're proficient in. For example, if you're proficient in Igbo, Hausa, and Yoruba, you can also indicate that when registering or applying as a listed medical doctor on the CloudClinic app. Also, we automatically match you with patients who either are proficient in same languages or who the person speak to in their native language. So essentially, we have a system such that it caters for people who may not really understand English, but also want to consult in their native language with listed medical doctors. Another of our amazing feature is diagnostic and pharmaceuticals. CloudClinic offers a wide range of diagnostic and pharmaceutical options through our partners. All right, our partners are our strength, as the MD has emphasized, and we are able to offer this particular feature through the strength of through the partnership with our partners all over Nigeria. We have a wide range of diagnostic options. People who consult in CloudClinic can request for, as a doctor, you can request for various types of investigation tests, be it malaria or other tests that may vary, depending on the observation that you have with that patient. Also, we've partnered with a lot of pharmacies such that a patient can purchase any kind of drug in any dosage that has been prescribed by the listed medical doctor on CloudClinic. Moving further, we've said something about the Medical Knowledge Center, which is an interactive medical hub. We've made it exciting such that the Medical Knowledge Center, articles that are posted by doctors on the Medical Knowledge Center can also be shared across different platforms by the patients. All right, this gives our listed medical doctors a wider reach. Also, we've also modified that feature such that patients can also comment on a particular article. So an example is, if I'm a doctor and I post an article in the interactive hub that has to do with having a good sleeping habit, a patient can visit that article and also post comments on how that article has either helped him or her, and can also share that same article across different platforms. This also increases your visibility through CloudClinic. Another fantastic feature we have is the specialist on demand. Cloud Clinic features a wide range of medical specialists. One of the things that one of the processes of applying as a listed medical doctor on Cloud Clinic is you have to indicate your specialization, be it a cardiologist or a general surgeon. This gives our patients a wide range of specialist doctors that they can select from and consult with anytime, any day. And we have our location-based service. Our location-based service is unique such that we give our patients turn-by-turn navigation to our physical healthcare service providers near them. All right, it's one of the exciting features that we have in Cloud Clinic, such that once you consult with the patient and you either recommend an investigation test or prescribe a drug, we automatically connect that patient to a healthcare service provider near them and also give them turn-by-turn navigation on how they can access that particular healthcare provider. And we also have seamless payments. So for seamless payments, once you've applied and you've been approved as a listed medical doctor, automatically you have a wallet that has been created for you on the app. All you have to do is set up your bank details so that you can access your funds. And one other beautiful thing is that on our platform, you don't necessarily have to wait till the end of the month. So you can access the money from your wallet anytime, through the Cloud Clinic Partner app. So we've offered a seamless payment to the wallet so that after a consultation, your wallet automatically gets credited, and at the same time, you can also access those funds anytime you wish. And another feature of the Cloud Clinic Partner app is the convenient healthcare service delivery. With Cloud Clinic, you can utilize and maximize your time and deliver quality healthcare service based on your availability. So we've made the app flexible so that you can indicate a time of the day that you're available, and also you can also customize it so that it stops at a particular time. So we made it such that your availability, which is your greatest tool, can also be maximized using Cloud Clinic. And one of our exciting features is the extra source of income. As I've mentioned earlier, with our seamless payments platform, which is our wallets, you can also get access to your funds after any consultation has been completed. So essentially, we also add an extra income to your bank account. As it says, Cloud Clinic enables you to add some zeros to your account balance. Then finally, you can consult from anywhere. You can consult your patients from the office or from home or on the go. Partnership. Our proprietary technology will help you work seamlessly with different stakeholders in the healthcare sector, irrespective of your location. So with our partnership with various pharmacies and medical laboratories all over Nigeria, you can effectively collaborate with all these facilities, irrespective of your location, by prescribing a drug and recommending an investigation. Also remember that our system automatically sends that patient, to each of those facilities by giving them turn-by-turn navigation. And this is a wonderful announcement, which has to do with the wallet system. Like I said, you have access to your funds at the end of a complete consultation. So if you choose not to wait till the end of the month to access your funds after a consultation, you can also do that immediately by just accessing it from your wallet to your bank account. Then over here, I have the money matters. So one unique thing that we've done with Cloud Clinic is such that you can set your consultation fee. So your consultation fee can be set by you, and we only charge a 20% service fee or a 20% commission on that consultation fee. Also with the app, you can track your earnings. You can track your earnings by visiting your wallet and just taking a look at the transactions. And also the listed medical doctors now have access to their funds through the wallets immediately after a consultation is completed. All right, so this is a customer journey for how to apply as a listed medical doctor. First, you visit the web link, which is www.cloudclinic.com/doctor application, or doctor application, www.cloudclinic.com.ng/doctor application. That link will also be shared to all listed medical doctors and attendees on this call. Second, you fill in your personal information and your email address. For the third item, you have to provide a brief information on your medical career. You also provide your MDCN folio number and also a copy of your certificate. You have to upload that for verification purpose. And finally, you set your availability. So your availability is you have to set or indicate the time that you'll be available to receive consultation. And the unique thing is you can also make these repeats at any frequency you want. If you want it to happen daily, if you want it to happen weekly, or just for the weekend, or for a custom time period, you can also make that flexible. Then after that is done, you now set in your consultation fee. So your consultation fee is the last step. And once that consultation fee is set, you submit your application. And after a few days, we review the application, carry out all necessary verification, and we approve your application as a listed medical doctor on Cloud Clinic. Okay. So I would have to play the video and for the LMD onboarding process, and I would hand over to one of the panelists to share his screen and play the video for everyone. Thank you.
Here's how to sign up as a listed medical doctor on Cloud Clinic in 3 easy steps. First up, visit cloudclinic.ng/doctor application. Fill your personal information as required. Next up, fill out your medical information. This includes your years of experience, MDCN, folio number, and your areas of specialization. You should also upload your MDCN certificate and profile picture at this stage. Create your appointment schedule, then hit Save and Continue. Lastly, input your consultation fee, and that's it. We look forward to welcoming you on board.
All right, thank you. Yes, so I'll move to our progress reports, and our progress report just highlights some of the achievements that we've recorded so far. The first is our MVP of the system design. It's interesting to note that we'll be launching in a little over 2 weeks from now, and we are proud to say that we've completed our MVP design for the launch. Also, we've signed over 60 partnerships with healthcare service providers across Nigeria. I think the MD also made mention that we have close to 800 which are already in the agreement stage, and onboarding has already started with these partners that we have all over Nigeria. So far, we've achieved 200 listed medical doctors pre-registration so far on Cloud Clinic. This also captures doctors who have also applied as a listed medical doctor and are currently being reviewed. So if you haven't applied as a listed medical doctor, please proceed to the link and start your registration now. Once that registration is done, we'll also have to go back to verify you before we approve you on that system. Also, we have over 150 patient users that are waiting our service. Currently, we have a waiting list, and that number is way above 150 patients who are earnestly waiting for us to launch, to start using our service. Outside of that, we've launched our platform. We've launched our platform for the listed medical doctor onboarding. So the link will be shared by the host, and you can visit that link to start your application as a listed medical doctors. And finally, like I've mentioned before, we've also commenced onboarding of the users. So this consists of our partners, which we've signed over 60 partnerships today, and also consists of some of the doctors which we are currently verifying. We're verifying the application and we'll be approving them within the coming days. So this is just a snapshot of our progress. We are doing big things behind the scene, and in the coming weeks, that will be revealed to the general public. So quickly, I would hand over to the host to call up the clinical director to take up the rest of the slides. This will also address some of the concerns as regards the house rules and our policy operating on Cloud Clinic. Thank you.
All right, thank you very much, Flourish, for that well-detailed explanation. I'll be calling on our clinical director now, Dr. Amy Ojako, to take us through the next phase of the webinar. Dr. Amy, over to you.
Thank you, Lola, for being an amazing host. I also want to thank the Chief Executive for introducing the company and the app and the products. And also I want to thank Mr. Flourish Nnamdi for walking us through My CloudClinic App. So I'll be taking the last lap of this webinar presentation today. But before that, I want to say hello to my Hippocratic brethren. It's an honor to do this, present this to you, talk about the experimental consultation that we did some months back. That should be sometime last year. And then also talk about the house rules, which we've developed for best healthcare experience for you and for our patients too. So moving through to the experimental consultation, we did an experimental consultation last year around December, between November and December. And there was a lot of learning during the experimental consultation because we wanted to simulate the entire process. We used actual patients, we simulated the process, how it will run through, and then we learned a lot. We learned the deficits and we solutioned them, and we are about presenting to you the perfect product for a wonderful healthcare experience. All right, can we go to the next slide to discuss the house rules? Talking about the house rules, I want to start by welcoming us to Cloud Clinic Limited, which is a healthcare company that is engineering a platform that connects different players in the healthcare industry, right? The company developed these house rules. I mean, every house has the rules, and it's in view of the fact that our doctors, Cloud Clinic doctors, known as the listed medical doctors, are the ambassadors of Cloud Clinic Limited. I mean, when patients have healthcare experience with you as the doctor, what they know is Cloud Clinic Limited, right? So we are bringing in the best healthcare service to our patients, and these house rules are informing our choice of who that we are bringing into Cloud Clinic Limited, right? So I have something on my screen, sorry. The instructions in the house rules, they actually are there for us to follow. We encourage the listed medical doctors to observe the code of conduct. Concerns regarding any of the house rules should be emailed to houserules@cloudclinic.ng. Ensure you input your full registration number correctly for verification from MDCN. Mr. Flourish talked about the Medical and Dental Council of Nigeria verification process that we are currently passing our listed medical doctor applicants through before we confirm the application. So it is important that you input your full registration number correctly because we are going to verify that with MDCN. Ensure your practicing license is up to date. Always always renew before the year runs out. Renewal of licenses are once a year at the end of the year, or at any time of your choosing. But it's important that you renew that at the end of before the year runs out, so that in the coming year you have a fresh license that you're practicing with on the Cloud Clinic. Provide a good standard of practice and care. Negligence and sorry, can you still go back, please? Okay, apologies for that. Ensure your practicing license is up to date. I've talked about this. So the next is to provide a good standard of practice and care. Negligence and malpractice are greatly frowned at. You must recognize and work within the limits of your competence. We have medical officers on our platform. We have the specialists on our platform, the general practitioners, right? So if you have if you're managing a case that is beyond your competence, your skills, your knowledge, it's important that you refer to the next available healthcare practitioner or a specialist in Cloud Clinic Limited that can manage that patients or manage that case with excellent healthcare service delivery. Right now, ensure you attach your picture in the LMD profile. While creating your profile, we watched the video to onboard the listed medical doctors. So it's important that you affix your picture. It's not allowed that you fix a picture that is not yours or an image, a totally different image, on your profile. It's important that when the patients come to Cloud Clinic app to say, hey, I want to consult with this doctor, they are already seeing your picture, and if you start the consultation, it's the face that they are seeing, the face that they've seen, that is what the doctor that they're consulting with. Let's go to the next slide to discuss the different house rules specifically. So we have the house rules on appointments. Consultations are by appointment, through rescheduling 2 hours before consultation. Endeavor to reschedule in situations where you cannot meet up with the consultation. It is not allowed for you to hand over that consultation to another doctor. In the physical or the traditional hospitals, we have locum services. So where you're not available, you can invite another doctor to cover your shift for that period of time that you're not going to be available in your physical hospital. But in Cloud Clinic Limited, if you're not going to be available and you've already accepted a consultation, please, it is important that you reschedule or cancel that cancel the consultation and not hand it over or employ locum service. So locum services are not allowed in Cloud Clinic Limited. And the last rule on appointments is to ensure timeliness to consultations. It's important that we keep the doctor's time and not the African time. So let's move to the next house rule. The next house rule is on environment. The LMD is required to set up a professional space for virtual consultations. Ensure the consultations are done in a well-illuminated and quiet environment. You wouldn't want your patient not to see you, or you wouldn't want to be consulting in noisy environments. Ensure your environment is also one with a good network coverage for a seamless consultation without interruptions. The LMD is required to set up the professional space because patients will feel comfortable and secure if they feel with the professional space, they know their privacy is secure, there is confidentiality, and they'll feel more comfortable speaking with you as a listed medical doctor. The house rule on dress code. The LMD is expected to dress in a professional manner, just how you would in a physical consultation room. Let's go to the next slide on readiness for consultation. Okay. Ensure you are prepared for the consultation to make it professional, productive, and efficient. While the patient is booking an appointment, a consultation appointment with you as the LMD, there is a space for the patient to impute key important features of the consultation. By that, I mean the clinical symptoms that the patient is experiencing and some other files that might be relevant to the consultation. So we encourage you to go through the patient's information on the app before the consultation time. This saves you a lot of time and also hassle for you and your patients. The LMD is not prepared to I've talked about this, have another LMD replace him for his consultation unless otherwise scheduled. Okay, let's go to the next slide on devices for consultation. Right here, we are talking about the devices. The chief executive and the product manager in the person of Mr. Flourish mentioned the devices for consultation. So we have the CloudClinic medical devices, smart devices, easy to use. The patients can easily use these devices in their homes. So we encourage you as the LMD to also encourage your patients to procure these devices. This is important for their health, as these devices will enable them to also be monitoring their health status in their homes at regular intervals. All right, so let's move on to the next slide about privacy and confidentiality. All patients' information, that's the electronic medical records, is to be treated with patients' data confidentiality. This the confidentiality clause is recommended by the Health Insurance Portability and Accountability Act of 1996. That's the HIPAA guidelines. I'm sure we are conversant with this. And then the GDPR, General Data Protection Regulation Guidelines. So further information on privacy and confidentiality of our patients' information can be found in the privacy policy on the app. Let's move to the next slide to talk about the consultation process. Mr. Flourish also mentioned the completion of consultation process. And at this point, I would want to let us know that a consultation consists of the initial consultation and the follow-up consultation where applicable. At what times, what period do you need a follow-up consultation? When you send your patient for investigation, right? So if you're consulting with your patients and you need your patient to run some investigations, you send your patient for investigations. When the patient returns for the second phase of the consultation, it is still part process is only completed after you have consulted with the patient upon return from the investigation room or the medical laboratory. At the point where you are conducting the, sorry, I'm still on consultation process. At the point where you are consulting with your patient in the initial consultation, in the very initial consultation period, you are required to schedule a follow-up, a post-investigation consultation appointment with your patient. So you discuss with your patient, when are you going to, return? What time are you likely going to return for the follow-up? Let me review your results and then maybe now prescribe the medications for you. You are required to schedule that consultation at the initial consultation period. Okay, and then you are also expected to document the clerkship or history of the patient, the examination findings, diagnosis, investigations, and then prescription or your treatment plan or referral, as the case may be, in the provided clerkship space on the app. All right, let's go to performance, the slide before performance review. The next slide is on professionalism. Okay, all right. So the listed medical doctors are required to be professional and treat the patient with utmost respect and care. Strive to meet your patients at their communication level. We have the native languages feature on our app. So if, the patients have the liberty to pick the particular language they are conversant with. If that patient wants to converse in Pidgin, the patient would pick that, and then so we expect you to meet that patient at their communication level and converse adequately with them. Let's go to the next rule. Okay. The next house rule is on the Medical Knowledge Center, right? So posts on the Medical Knowledge Center are expected to be strictly posts about health awareness creation, health advocacy, and health education to our patients. So you've done some research and you want to talk about benefits of getting a good sleep, right? So you talk about that. It's strictly on health. What will benefits your patient's health. We do not allow posts on social matters, politics, fashion, and the rest. The post on the Medical Knowledge Center is strictly on health matters because it is a health blog site or center. The posts that are not related to health are not allowed for publishing on the Medical Knowledge Center. Let's go to the very final house rule on the performance review. All right, so at this point, we want to inform our LMDs that the patients are going to be assessing their performances. The LMD's profile projection on the app is dependent on the number of consultations done and the consultation review score by patients. So the patients would be reviewing you as you're consulting, and then will give you a review score after your consultation. I think that is the end of the house rules. Can we go to the next slide? On links. All right, so here we have the link to the house rules in details. Then we have the links for those of us that have not signed up as listed medical doctor to sign up, and then the referral link for the licensed pharmacies and med labs. As the chief executive has implored on us, if we have patients, if we have facilities that we are very conversant with and we are very comfortable using, we trust them, we trust their results, we trust the medications they are giving to our patients, we implore on you to refer those facilities to us or refer us to them. Let's go to the next slide. So at this point, it's a hooray period because we are happy to announce that our launch date is on the 18th day of April 2023, just less than a little above 2 weeks from today. We'll be launching our app. Let's go to the next slide. To talk about frequently asked questions. So we've been receiving lots of questions from the doctors, and we decided to put it up here. This might answer some of the questions bugging us as this webinar is progressing. What is the cost of a consultation? The listed medical doctor fixes his or her consultation fee for the consultation. So whatever you want to fix, you're responsible for that. Okay, we do not fix any cost, the cost of consultation for you. The next question is, when can I have a consultation? You can have a consultation at any time of your availability in a 24-hour day. The next question is, let's go to the next question. Will the patient pay for the second phase of the consultation? No, a consultation includes the first phase and the second phase, where you will review the patient's investigation results, and the patient pays once for the consultation. Let's go to the next slide. Can I have a consultation while I am in a moving vehicle? No, a consultation should be in a quiet, well-illuminated, network-enabled environment. Any environment with these features is acceptable. Okay, let's go to the next slide. What kind of doctors are you looking for? Specialists or general practitioners? We are looking for both. Specialists in training, I mean, the resident doctors, and then the general practitioners, the medical officers. We're looking for all of you. We need you on our platform to attend to the needs of our patients. Let's go to the next slide. When do I get my consultation fee after consultation? The consultation fee is deposited into your CloudClinic wallets. You now have access to your funds immediately after a consultation is completed. Can I give out my personal phone number to my CloudClinic patients? We understand doctors are not comfortable giving out their phone numbers. I am not comfortable giving out my phone numbers. So on this note, every LMD has a CloudClinic limited identification, which you can give to your patient for future consultation. So if the patient wants to consult with you next time, you can always give the patient your LMD identification. Okay. What do I do if I need to physically examine my patients? CloudClinic is partnering with reference hospitals where you can physically examine your patient for a wholesome healthcare experience. So even if you need to admit that patient for inpatient care, we have the reference hospitals available for that. Let's go to the next slide. What do I do if a medical lab sends in wrong investigation reports? Right now, we have cases of wrong reports being sent in, but there are two situations here. It's either is a typographical error or it is a totally false report. So you as the doctor should be able to decipher which of the situation is applicable. So if you decipher that this is a typographical error, by all means go ahead with the report. But if you are certain that this is a false report because the findings in the report is not in tandem with the clinical features that your patient is presenting with, kindly report the wrong or false report to support@cloudclinic.ng. We have our staff ready to take it to the next level and return to you with the correct reports. Can I be an LMD without having to upload medical information on the Knowledge Center? Yes, you can be an LMD without uploading medical information on the Knowledge Center. However, doctors that upload information on the Knowledge Center will have more visibility as this increases the LMD's Cloud Clinic reputation. Patients are more likely to consult with doctors that they like their contents on the Knowledge Center because it's like a blog. So if your article is always, you're always posting article on the blog on the Medical Knowledge Center, people are seeing it from all over the world, and then patients can easily hop on your Cloud Clinic profile and then book an appointment with you. Let's go to the next slide about traveling out of the country. This is the JAPA period. Can I practice as an LMD from the USA or the UK or Canada or any country I want to travel to? If yes, will I be paid in Nigeria or that country's currency? Yes, you can review your patients using Cloud Clinic platform from any part of the world you want to travel to, and you will be paid in Nigerian Naira. Okay, let's go to the next slide. At this point, we'll take the questions from the audience. But before that, I want to thank us for listening in, tuning in to the completion of this webinar. And I would also want to introduce us to our social media handles. You can connect with us so that we can provide you with more information on our products. We are on Instagram at Cloud Clinic Limited. We are on Twitter, Cloud Clinic, and we are also on Facebook. We have our WhatsApp number that you can use and connect with us. We have our email address, support@cloudclinic.ng. And then we are also on LinkedIn, Cloud Clinic Limited. And you can visit our website, www.cloudclinic.ng, to connect with us and get more information on all our products. Thank you for listening. Lola, you can take over hosting us. Thank you.
All right, Dr. Amy, thank you very much. Thank you very, very much for that amazing presentation. As we can see, Dr. Amy was able to go over some frequently asked questions, but of course, there are some questions that are not so frequent. So we've been having some questions, and I've been seeing my CEO personally answering a lot of these questions by himself. So I don't know, do you want us to go through these questions that has been answered, or should we just keep straight to letting people that have their hands up, giving them the permission to speak and then ask their questions?
Yeah, since we have some hands up, I think we can start with those ones. And then I might need to talk about one or two of those items we've answered on already. So if you want to ask a question, please raise your hand up. We'll give you the permission, or we'll give you a mic and allow you to speak.
All right. There's someone with his hand up. Okay. I can see Emedion Akpan. The hand is up. Can the host kindly give Emedion Akpan the permission to speak? Okay, you can unmute yourself now and go ahead. Okay, I think the hand has gone down. All right, I think, okay, so if you have any question, you can just raise your hand, and then we will give you the permission to speak, and then you can ask your question live, basically. So if you have any questions, so just, also, if you still have questions, you can drop it in the question and answer box. But like my CEO rightly said, there are some of these questions that I think would benefit us if he can like expatiate on it and answer them verbally. So one of the questions is, someone said, please kindly clarify these. Number one, every patient who uses the Cloud Clinic platform is expected to have a sphygmomanometer pulse oximeter and glucometer if necessary? So that is a question. Mr. Ifeanyi, can you kindly answer that?
Yes, I can do that. So I already tried to answer that in the chat as well. So what we've done is that we are partnering with medical device manufacturers that are coming up with really very useful and easy to use devices, and really mainly for vital signs. So things like blood pressure monitor devices, and other ones that you need really to capture like your temperature, the oxygen saturation in the blood, and things like that that a doctor would need before they can start a consultation. So those are the ones that we're starting with. And the idea is that we're looking at getting this at relatively cheap prices in homes. So we're encouraging our doctors to talk to these patients and tell them to buy these devices because it helps. And if they have the device in their homes, they don't need to leave their house to go to anywhere at all to receive care, because with that device in their house, a doctor will work with them, they get the vitals out, and then they can consult with them. And if they want drug delivered to them or even collect their samples from home, that can happen with ease. However, we know that even if, no matter the amount of money this is sold at, there are still some people that wouldn't be able to buy these devices. So what we're doing is that we're having consultation with our partners, and some of our partners will be able to also take vitals of patients that can't afford those devices, right? So you would require them to walk to a nearby pharmacy or to a nearby med lab to get their vitals taken. But it's something we're looking at doing rather than having to rely on do these things without vital signs, because the vital sign helps the doctor during the consultation process. So that's what we're doing concerning that. Then for physical examination, I also try to explain that as well. We're partnering with reference hospitals, and there are doctors that are there that can do physical examination. And what we are doing is that we're grouping physical examination and lab investigations as the same, right? So if a doctor needs to is consulting with a patient and he feels he needs to examine that patient physically somewhere, he wants a physical examination on that patient, he will recommend that as an investigation, and then we'll direct the patient to the closest place where he can do that physical examination. Once that is done, the patient is still your patient. The result is uploaded into the platform. The patient will come back for a review, and then both the physical examination result and the result from other investigations, if there are more, you review that with the patient and then prescribe drugs to that patient as well. So that's how we've implemented this, and that's how it's going to work.
All right, sir. Thank you very much. I can see Adedayo Dele has his hand up. The host kindly give Adedayo the permission. Oh, all right, Adedayo, you can unmute yourself now and then ask your question.
Okay, so hello, good afternoon, everyone. Yes, I'm Dr. Dele. To begin with, I'm excited. I can't wait to come on board. I'll begin to have consultations online. So yes, so I did ask my question on the chat box, but I just want to reiterate again. Okay, so I saw one of the admins answered that it takes some 5 working days to have a doctor verified. I mean, after sending your details and all. So I remember specifically that it has been a while now. I can't really remember for how long, but it has been a couple of weeks since I've registered and uploaded my documents and what have you. But then I don't know. I don't think I've been verified yet. I just want to know what could likely be the cost. An email has not been sent to me, so to speak. Yeah. I don't know if I should be expecting some other notification. I've checked my spam email. It's not there.
Yes. So
yes, that's my question.
Okay. Thank you, Adedayo. Thanks a lot for that question. I think I tried to clarify the answer from Amaka. It takes 5 working days, but we haven't started that process yet. So we'll be starting that most likely towards the end of this week or early next week, because we had like a couple of things we're trying to do in readiness for the go live, and we kind of pended that, but you should hear from us by next week. We're going to start with those that applied initially. So people like yourself that applied first, we'll start from that backlog and then start the verification process. But yes, we haven't We haven't started the process yet because there were a lot of other things we're focusing on, but you should get to hear from us by next week.
Okay, no problem. Thank you, sir.
Thank you as well.
All right, thank you, Dr. Dele. Thank you, Mr. Ifeanyi. There's a question here from an anonymous attendee that says, how does one send a facility to you that you might partner with?
Yeah, you want me to answer that, or you already have an answer for that, Lola? I think you are the person, the director for partners in CloudClinic. So go ahead.
All right, anonymous attendee, what we have as of today is that as a doctor, we'll send you a link, and then you can share that link with the facility that you want to partner with us. But of course, once the app launches, there's like a full-scale referral service for the doctors, where as a doctor on CloudClinic, from the app, you can refer facilities to partner with CloudClinic. And of course, there's something in it for you as well that I can't get into right now. But as for today, after this webinar, we are going to be sending the links. There are several links that will be sending to you. And one of them is going to be the link to refer partners to us. And once you share that link to the facility, the pharmacy or the medical lab or the reference hospital, and they fill the form, we are going to reach out to them. I hope I've been able to answer your question, anonymous attendee. All right, so there are other questions here. Okay, this one has been answered. Okay, so Mr. Ifeanyi, I wanted to clarify this question, or maybe Dr. Amy. This Anebe Etim says, for those of us who haven't received our license from MDCN, but have paid, can we send our payment receipt as evidence that we have current practicing license?
Yes, definitely you can. You can send your payment receipt. Payment receipts are also used to apply to work in hospitals, you know, when the medical and dental license is yet to give you your new license for the year. So yes, you can send in that. Thank you.
All right, Dr. Amy, thank you very much. I have a hand up here by Winifred. All right, Winifred, you can unmute yourself to speak.
Okay, hi, good afternoon. My name is Dr. Winifred, the medicine. So the last question brings me to ask. Now, in that application form to be an enlisted medical doctor, what they are asking for, is it MDC certificate or current practicing license?
Okay, thank you, Dr. Winifred, for the question. We are asking for your MDCN full registration. That's your certificate, right? Then in the app, right, there is a spot where you're supposed to insert your documents, upload your documents. So we need your current practicing license and then the full registration, because for every year we need the current the practicing license for that year. But bottom line, we need your full registration to be sure that you are fully registered, because CloudClinic does not work with house officers. House officers are only permitted to sign up and pre-register. Then after their supervised training in the tertiary institutions and they have their full registration, they are now medical officers or general practitioners. They can now come on board and start practicing. Does that answer your question?
Yes, it does. So it's full registration then. That's fine. Thank you.
Thank you.
All right, thank you, Dr. Winifred. Thank you, Dr. Amy. All of the questions has been answered. So if you still have any question, kindly raise your hand and then would attend to you. We'll give you the permission to speak so we can answer your question. Okay, so there's a question here that says, concerning the MKC, will LMDs be provided with topics to write and publish, or do we research and come up with these topics ourselves?
Yes, I can answer that question. We're not going to be giving you topics to write. You come up with topics yourself. The guidance there will be for you to look at the themes that you're most comfortable in. So if you are worked with a particular patient in a particular area and you understand that aspect of medicine very well, or there is just something about it you want to write about, please go ahead and write about it. It's not a situation where we're telling you topics to write. It's open-ended. The ideal thing is for you to write things that you think people would, benefit from, right? So if someone reads this article, will it be useful to that person? Would it help the person avoid a particular sickness, for instance, and things like that? Those are things that I think should be happening. You should be writing about. Remember that your content will be indexed by Google and other search engines, so that it would also drive content to you. So you have to be thinking about it to say, what are the things I want to write about that people would want to read, and then when they read it, they would get better, and they can, if they want to know more about it, they can reach out to me, so that they can now consult with me. So it's also to some extent a marketing tool for your personal brand when you write those things. So we're really giving you this platform to be able to reach the world using the MKC.
All right, thank you, sir. I have 3 new questions here. Anonymous attendee says, hello, what is the minimum and maximum allowed consultation fee per patient or consultation on CloudClinic?
So right now, the minimum that we're charging is 1,000 naira. We won't allow you go below 1,000 naira on the platform. You can come close to that number. We would always, with our technology, suggest to you the kind of amount to put as we keep going. But then we've seen people, charge up to 5,000. I think that's the average. When we did our survey, it's revolving around 5,000 as average. But you're free to put your own pricing. So as low as 1,000 is okay. There is no maximum. It can put any maximum value that you have in mind. It's up to you, but it's like a market. So if you put an amount that is too high, there's a possibility that people won't consult with you. So you really have to weigh that. We have to put a minimum of 1,000 because we need a particular minimum for us to be able to maintain the infrastructure that's enabling you to have that conversation. If not, we would have made it, completely open. But there are some server cost, bandwidth cost, processing cost, compute cost that is involved in allowing you have that consultation with a patient. And because we take a percentage of that, it has to be big enough for us to have captured that and be able to pay for those things. So that's that would be my response to that. So minimum of 1,000, no maximum.
All right, thank you, sir. Christian Emmanuel says, do we wait till 18th April before downloading the app?
Yes. The app will be available on the App Store on the 18th.
All right, thank you. Anonymous attendee says, can consultations be done only via the app?
Yes, it will only be via the app. You can't do consultations outside the app the way it works within CloudClinic. So you would have to schedule an appointment with the patient, and then they come online at that time, and then you have the consultation with them using the app.
All right, thank you. Anonymous attendee says, well done, guys. As with all the apps, does your app have a predicted troubleshooting premise in an event of a glitch in operations?
Yes. So what we have is that we have a support team in place. And if you have a problem with the app, we're going to, first of all, we have a monitoring solution in place that is monitoring the app performance and how it's working. So if there's an issue with the app, we would know even before you reach out to us. But then there's also a way for you to reach out to us in case we missed it. So there's the support link that you can reach out to us to say, hey, I'm having this issue. And someone will jump on it and help you resolve that problem if it exists. We hope there'll be minimum of those kind of issues, but we know it's technology and sometimes they will break. So in cases like that, we have people on standby waiting to help you through that process. And then, like I said, we're also monitoring. So if there is any issue we're seeing, we're on top of it even before you reach out to us.
All right, thank you. Another question here says, will CloudClinic deduct its percentage before the money is deposited in the CloudClinic wallet after consultation?
Yes. What happens is that once you're through with the consultation, that means the consultation is done, which means if you did request of investigation, you have now reviewed this investigation with the doctor, with the patient, and you've prescribed a medication for the patient, and that is concluded. That money automatically becomes available in your wallet. But what you get in your wallet is less the percentage in question. So which in this case is 20%. So the money you will have in your wallet, you can withdraw at any point in time, is the consultation amount less that percentage.
All right, thank you very much for that. I have another question here that says, are there any fees LMDs are or will be required to pay?
No, there is no fee you're required to pay. The model we have here is that of commission basis. So we're providing this platform for you, and we need to keep the platform alive and keep the staff paid. So we take a percentage, which is 20% of your consultation fee, and that is what it is. And you are the one setting the price yourself. So it's not like we are, fixing anything for you. You choose your consultation fee, and then we'll take 20% of that value. So that's how it works with us here. There is no fee, no registration fee that you have to pay, no annual fee you have to pay, no renewal fee or anything like that, not from CloudClinic. Basically, when you do a consultation on our platform, we'll take a percentage, and that is it.
All right, thank you. Someone says, will there be another webinar just before the official launch on 18th April? And how can I know if I've been selected?
So if you're selected, you will get an email from us. I believe most people that applied that have valid license will be selected, except once we hit the maximum number for the launch. We have a number that we have. Once we get to that number, we would stop admitting people in and put a gate there, but it's a temporary gate because we want to be watching the doctor to patient ratio on the platform. And because we want any doctor admitted in should be busy and happy and making money on the platform. So that's what we're looking at. So that doctor to patient ratio is being watched and monitored internally. So it will get to a point where we'll stop admitting people. And then once the patient ratio increases again, we would open up that gate again to bring in more doctors. So that depends on your specialization, depends on your availability, the time you're normally available, on a bunch of other factors like that. So, but I believe for now, we haven't reached that number yet. So this is the time to apply, because it will be on first come, on a first come, how is it said again? First come, first get service or something. So the person that comes in first, gets it first. But that also depends on your specialization and availability as well, because we want to make sure that our people are available for our patients, around the clock. So in choosing your availability as well, it will also determine if you're going to come in, if you're going to be, put in a wait list for now. But like I said, virtually everybody coming in now, because we haven't reached that number, most likely we'll be able to get in, especially if you have, of course, if you have your license is adequate and you have availability in the system.
All right, thank you very much. This is not a question, a statement from somebody saying that they applied to be an LMD, but they've not gotten the verification mail. I think we answered this already. You will be getting it latest by next week. Thank you. Yeah, I think those are all the questions we have time for today. At the end of this webinar, we'll be sending you a survey link where you can ask further questions, and then we'll try to get the answers across to you, definitely. So we'll be rounding up now. I want to use this opportunity to thank our CEO, Mr. Ifeanyi Aneke, for taking the time to attend to this, to attend the webinar, and of course, attend to the questions to all of the questions that has been asked. I'm thanking the members of CloudClinic team, Flourish Namdi, our product manager, Dr. Amy Ojako, our clinical director, Mrs. Roslyn Wamaka Ezekwesili, our program coordinator, Ejiro Pepe, our business development manager. There is Kevin Alozie, our head of graphics and media, and of course, our digital marketer, Miracle. Thank you very much for taking the time to attend the meeting, and of our content writer, Emma, of course. Thank you very much. Also, a very big thank you goes to the technical team of CloudClinic for the updates and everything they have been doing to have the app ready for launch by the 18th of April. And of course, thank you very much to all of our attendees. Thank you for taking the time out of your busy schedule to attend the webinar. Okay, Dr. Uchenna helped you, Mr. Ifeanyi. They said first come, first served. So that's how I said. Thank you very much, Dr. Uchenna.
Thank you very much. I think
thank you very much.
I lost my train of thoughts there. Thank you, Dr. Uchenna, for pointing that out. Appreciate it.
All right, thank you. So we'll be sending you the link to, if you've not done your onboarding, we'll be sending that link to you. We'll be sending the link to fill the survey, like I mentioned. We'll be sending you the link to our social media handles as well. And then we'll be sending you the link to refer partners to us and a lot of other links. Thank you very much and stay tuned. My name is Ololade Olaleye. See you next time.